Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeo Remedies for Prolapse of Rectum. What is prolapse of rectum? First, let us know what a prolapse is. Prolapse is falling down of a body part from its original position location. So rectum prolapse occurs when rectum falls down or slips down from its original position at the terminal end of the colon to the anus or further down below to come outside of the body. Look at the picture on the right hand side. Note here, this is the position of this rectum was in this area, but now it has fallen down through anus to outside. This is mucosal membrane, actually these are types. Two types or three types are there, external, internal, mucosal, that has been shown here. The main thing is that the rectum has fallen from its original position to outside of the body or at the level of anus. Both is possible because normal position was much above. Now it has come down, it has fallen from its original position. So it is prolapse. What are types of rectum prolapse? External, when entire rectum sticks out of the anus. Picture E, note the picture this. The entire rectum has come out. This is E, and internal rectum just starts falling down. That picture is not here. Mucosal, part of mucous membrane of the rectus pokes out. This is mucous membrane. Only mucous membrane has come out. Part of the mucous membrane, not the whole rectum. This is whole rectum. This is the mucosal portion has come out. These are three types. What are causes of rectal prolapse? Long history of overstraining during passing stool. During passing stool, overstraining, say due to constipation, due to dysentery. There are so many conditions. History of chronic diarrhea, constipation, that's right. Nerve damage controlling the muscles of rectum during childbirth or pregnancy. Old age due to weakness of rectal muscles, ligament, nerve. Part of injury to hip or anal area. Injury to spinal cord or disease of spinal cord affecting the nerve of rectum. Actually, any muscular organ remains in its original position with the help of muscles and nerve both. If any one is damaged, then the place may be displaced. What are the symptoms of rectal prolapse? Feeling of sitting over a ball after passing stool. Feeling a bulge outside anus during ablution. Ablution is washing of the anal, opening of the anus. Seeing a red mass outside anus. Pain in or around anus. Bleeding from rectum. Incontinence or leaking of blood, mucus, stool from anus. These are all same thing, the different types of picture. Rectal prolapse or hemorrhoids. That is, how would you know whether it is hemorrhoids or prolapse? Because both of them are in some sense look alike. External hemorrhoids, that is inflamed, swollen, bleeding blood vessels of lower rectum, somewhat look like rectal prolapse. But clearly, these hemorrhoids differ a lot from rectal prolapse. Attending doctor would confirm the nature of the disease. Actually, it is a verdict from an expert. You ordinary person cannot tell what is what. The surgeon is the best person who will take the decision that yes, it is rectal prolapse. No, it is hemorrhoids. What are the risk factors of rectal prolapse? Ladies who are 50, suffering from chronic constipation, having low back injury or disc disease, having weakness in muscles of anus or pelvic floor, having history of rectal prolapse in the family, that is some previous, senior members were there in the family who was suffering from rectal prolapse. Schistosomiasis is some sort of parasitic infection. Schistosoma type of parasites. Benign prostatic hypertrophy. Congenital bowel disease like neurological intestinal dysplasia. Chronic obstructive pulmonary disease. This is due to lung cause. From lung, the prolapse may be there because constant coughing give rise to this prolapse. How diagnosis of rectal prolapse is confirmed? While inspection by an expert surgeon is sufficient for confirmation, yet there are a whole lot of modern investigations are available, of which MRI, magnetic resonance imaging, and or anal ultrasonography give decisive confirmation. There are at least 10 to 8 different types of modern investigations. I have mentioned only the most common things, and these are confirmatory. Now look at these pictures. This is piles or hemorrhoids, and this is not piles but the anus, the rectum has come out. So this is prolapse, not hemorrhoids. How can rectal prolapse be prevented? Get sufficient fibers in diet. Sufficient fibers in diet would control constipation. At least 4 servings of fruits, veggies in a day. Drink at least 8 to 9 glasses, each glass 30 ml a day. Perform physical training, that is exercises or workouts, whatever may be, for half an hour at least every day. Keep body weight under control. In case of chronic constipation, consult a good physician. Do not practice taking laxative daily. How diagnosis of rectal prolapse is confirmed? While inspection by an expert, that is already, I have already mentioned this. Now this is a ultrasonography of a child of rectal prolapse. This is an expert thing. We cannot generally, ordinary doctor cannot interpret this picture. These are the expertise of sonologist. Now the remedies. Podophyllum for rectal prolapse. Rectum comes out in the morning after passing profuse fetid watery stool. Mind this, after passing watery stool, rectum has come out. Already it is damaged. After stool, sneezing, coughing, force rectum out. Ignatia for rectal prolapse. Intense urge for stool, but no stool comes out. The more they push, the more to urge to pushing. Itching in anus. Simultaneously, prolapse is also there. That is not written, but it is implied that prolapse is there. With this prolapse, these symptoms are present. Acid mure or muriatic acid. Acid muriaticum or muriatic acid for rectal prolapse. Prolapse of rectum during urination. It's single, specific. During urination, prolapse of rectum, acid mure. Allosocotrina for rectal prolapse. In morning after rising from bed or breakfast, bloody diarrhea with much tenesmus along with prolapse. Ferrum for rectal prolapse. For prolapse of anus in children. For prolapse of anus in children, 6x is specific. That is, in case of children, you can directly give 6x ferrum phos without any further consideration. It is almost specific. Ruta for rectal prolapse. During stool, if slight pressure is applied, rectal mass comes out. Sulfur for rectal prolapse. Anus intensely red, especially of children with itching. They crave for sweet, raw fruit, veggies. Feels intense hunger and very weak at 11 a.m. in the morning actually. Phosphorus for rectal prolapse. Burning in anus. As if it is open. Stools comes out easily. Patients like salty, sour, spicy foods. Epismell for rectal abscess. Anus swollen, sore. Sphincter as if loose. Sphincter means anal sphincter, which controls the stool. Stool comes out involuntarily. Characteristic of epismell. Involuntary stool. Lycopodium for rectal prolapse. Pain in hypogastrium. Hypogastrum is one of the region of 9 quadrant of abdomen that has been shown in the picture. Patient crave warm food and drinks. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down anything you like in the comment section. I would certainly respond.